ADHD stands for Attention Deficit Hyperactivity Disorder and is often described as a mental disorder. Children with ADHD have trouble paying attention, are hyperactive, and often have difficulty controlling their behavior. It is estimated that it affects around 5% of all children aged 3 to 17 globally, and that for every girl, around 3 boys are diagnosed with it. To understand how it affects children in school, let's look at the story of Leo, a 12-year-old boy who goes to school with the best intentions but struggles hard to succeed. Attention deficit is his biggest problem. Leo gets distracted so easily. It happens even when he tries his hardest to focus. He often realizes that he has suddenly zoned out and has spent the last 15 minutes thinking about something entirely different. Just the tiniest thing can get him off track. To him, it feels like his brain is broken. He is also forgetful. Books and homework are often left at home, and if he doesn't miss an assignment, he often loses it somewhere or forgets to turn it in. His grades are terrible, and some teachers are beginning to think that he is a lost case. Then there is his hyperactivity. When they have to do group work, he is restless and has trouble staying focused. Staying calm and listening while others speak can completely drain him, making any normal conversation a serious challenge. To him, it feels like there is no capacity left in his brain to deal with all the input that needs to be processed. He then feels angry about not being able to follow along. To help cope with his hyperactivity, he likes to keep his hands busy all the time. Last, there is his impulsive behavior. He often cannot refrain from saying things that come to his mind. Sometimes he tries hard to control himself, but then just blurts out and interrupts others. His classmates find this annoying. He later regrets his hot-headed behavior, but he knows that unfortunately, he will do it again and again. It seems to him that he can't learn from his mistakes. Teachers get frustrated trying to get him to behave. Others become impatient, give up, or distance themselves. After he is diagnosed and receives support through concrete steps, things begin to get better. At school, he is seated next to a supportive student in the front row of the class. He gets a notebook that lists all his assignments to help him remember. And to make homework easier to track, he receives it for all subjects only once a week. To relax, he is allowed to use fidget objects during lessons and take short breaks when needed. After school, he practices speaking and listening routines with a specialist. Additionally, his dad bikes with him to school every morning, and in the afternoon, he is allowed to play the ball as long as he wishes. For severe cases of ADHD, prescription drugs are often prescribed. Before that happens, children like Leo need to undergo a professional, age-appropriate diagnosis by a child psychologist who will try to look below the surface. ADHD could just be the tip of the iceberg. The root cause might be drama at home, bullying at school, poor sleep, or the wrong diet. Sir Ken Robinson told the story of Gillian Lynn, an 8-year-old girl that was said to have a learning disorder. She could not concentrate and never sat still. When she was brought to the specialist, who didn't prescribe any therapy but instead played music on the radio, the girl started dancing. He then told her mother, "Gillian isn't sick. She's a dancer. Take her to a dance school." Gillian Lynn later became a famous dancer and then responsible for some of the most successful musicals in Broadway history.
5 facts you need to know about ADHD. Attention Deficit Hyperactivity Disorder, or ADHD, is a mental disorder that affects the individual's ability to focus. They may need to move around frequently and might have trouble controlling their impulsive behaviors. According to the American Psychiatric Association, it affects roughly 8% of children and 2% of adults. Unfortunately, many misconceptions are attached to this disorder. For instance, many people believe with medication, ADHD can be immediately cured or grown out of. Some also commonly believe that it only affects boys because they're perceived as rowdy and rambunctious. We want to educate the public with only the truth, and we'd like to offer support to those of you who've been diagnosed with it. Here are 5 facts you need to know about ADHD. 1. Symptoms and signs of ADHD. First and foremost, we want you to know that it's never a good idea to self-diagnose. Please visit a health professional in order to receive reliable insight. Signs that doctors often look out for include disorganization, trouble planning ahead, impatience, difficulty with following directions, and an inability to sit still in one place for an extended period of time. This is more than just a matter of not being disciplined enough or being messy. An unmade bed or zoning out during a conversation are not enough to diagnose someone with ADHD. People with ADHD have trouble learning and often repeat their mistakes. Instead of losing our patience with them, it's best to approach them in ways that we can help them grow and feel understood. 2. Causes of ADHD. To this day, researchers still do not know the direct cause of ADHD, but there has been evidence that shows a link between the disorder and genetics. Researchers also point out other factors, such as premature birth or the diagnosed patient's mother facing severe stress or using drugs and alcohol during pregnancy. 3. Treatment options. Treatment options available for ADHD include medication, counseling, support groups, and behavioral therapy. Before deciding which treatment to use, please talk to a health professional. Dr. Rachel Klein, a professor of psychiatry, notes that the long-term effects of medication for ADHD are still unknown. There is also evidence that shows it can suppress the child's appetite, which can affect their physical development. While medication has been shown to be most effective by research, children who take it are still at risk to its side effects. It's good to be aware of them and know that there isn't just one right treatment option. We recommend that you explore all before making a commitment. Remember, you can stop anytime you don't feel comfortable. 4. What teachers can do. Teachers often complain about troublesome students who may have ADHD. Instead of punishing them for being disruptive, there are healthier alternative ways to help them learn. Allowing frequent breaks and promoting playtime is one way to help students with ADHD get up and move as they wish. Other helpful tips include encouraging more class participation and providing hands-on learning opportunities. This can influence students with ADHD to get excited about being involved in the lesson, whether it means being able to write their answers on the board or conducting a science experiment. 5. What parents can do. Parents can find it challenging to discipline and teach children with ADHD, but know that you're not alone and there are support groups you can join. One strategy to use is providing a structured routine. Children with ADHD have a hard time organizing and completing tasks on time. Set a time every day for them to do homework and a time they can play. Balance is key, but make sure the routine isn't rigid. Promote productivity instead of adding pressure on them. Expect your child to be headstrong and break rules, but avoid using helicopter parenting. Instead of making decisions for them, give them the freedom to learn from their choices.